Welcome to this session presented by Mrs. Prudence Amito. Today we are going to be looking at evaluation of patients' needs assessment. As we know, it is very important for us all to evaluate, even us who are lecturers, we do evaluate ourselves. We can evaluate. Evaluation helps us to get feedbacks from interventions that were put in place. It helps us to improve quality of care and a lot more. So it is important always to evaluate your assessments, even if not only on the patients. So evaluation is when you reassess yourself to know if whatever interventions or whatever assessments you have done was positive or negative. So let's look at the importance of evaluating primary patient's care. Why is it important to evaluate your assessment on the patient? So it's important because it helps us to ensure effectiveness and quality of care which we had provided. To allow the healthcare providers to assess the outcome of interventions, monitor progress, and make necessary judgments to care plan. So it is through evaluation that you're able to find out the outcome of your interventions, whether it was a positive one or there was no change. So through that, you are able to change your plan of care or make necessary adjustments to make sure that the patient receive or improve in their health status. So evaluation promotes continuous improvement, patient satisfaction, and optimal health outcome. So if you don't evaluate yourself, you might not know actually if the interventions you're putting in place is up to the patient's satisfaction or is bringing any improvement, or if it is bringing optimal health outcome. So until when you evaluate yourself, that's when you're able to know all those. Evaluating patients' outcome involve assessing the impact of primary patient care on the patient's health and well-being. So it includes monitoring. Improvement in symptoms, functional abilities, and overall health status. So as a midwife, how do you evaluate yourself? Let's say a mother came with eclampsia. So as we all know, then you gave interventions. You gave the mother maybe the magnesium sulfate, and you try to do other management of convulsions. So you want to evaluate yourself by coming back to the mother to find out what other symptoms of eclampsia is still there, or even you want to see are there any adverse effects of whatever of the drug that you've given, or is there improvement after giving the drug that you have given. So it helps to monitor improvement in symptoms. It also helps functional abilities and overall status. Patient-reported outcomes. Sometimes you can evaluate from the patient. You ask them, because sometimes if there are pains, you might have to ask if you're not able to assess the pain. So you can ask how they are feeling, and they give you a report of how they are feeling after your intervention. Then evaluating patient outcome helps determine effectiveness of intervention and whether their desired goals of care are being achieved. In most cases, it's very important for you to ask how the patients are feeling after whatever medication or whatever care or assessment you have given them. Assessing care care plan adherence is another way of evaluating yourself. So assessing care plan adherence involves evaluating the extent to which the patient is following the recommended treatment and self-care activity. So another way of evaluating yourself is by making sure that you go and follow the recommended treatment from the patient. You can even take the drugs, especially those ones who are admitted in the hospital. If there are some horrors that they are on, you can always go and follow up to see if they are actually taking the treatment as recommended. So it includes reviewing medical adherence, what I've just mentioned, compliances with lifestyle modification, and engagement in preventive measures. So whatever advice you had given them, you want to see if they are trying to follow or to adhere to the care of plan that you gave them. Assessing care plan adherence helps to identify any barriers or challenges that the patient may be facing and allows for appropriate support interventions. So this helps very much. Let's talk of mothers who are HIV positive. It is very, very, very important for you always to assess their care plan adherence to the ARVs, because we know that it is only and only when they are adhering to the drug that's when the baby, the fetus will not get HIV, because the viral load would be suppressed. So this adherence care plan is very important to evaluate. Another way of evaluating is collecting patients' feedback. So collecting patient feedback is an essential component of evaluating primary patient care. Yeah, you can ask them. You can ask the patient, do you feel like the care we are giving you is what you wanted, or are we overdoing it, or there are some changes that you want us to make? That is feedback you can collect from the patient. So it involves seeking input from the patient about their experiences. We want to know their satisfactory level. Are they satisfied with the type of care you're giving them? And also their perception on the care which is provided. So patients' feedback provides valuable insights into effectiveness of communication and the quality of care which is provided and the areas of improvement. So by doing that, you might find that there are some areas that you need to improve as you're providing care. It might be communication. Maybe you have not communicated well at some point. If you get a client who is able to tell you that you're not able to communicate well, that is feedback from the patient, and you need to improve on that. So the next is assessing patient satisfactory need. So assessing patient satisfaction is one of the ways of also evaluating yourself. So it involves measuring the patient's level of contentment with the care received. You can always ask them, are you contented with the type of care that we are providing? Should we improve? So that involves factors like communication, respect and autonomy, accessibility to services, and overall patient experience. How is your experience? Maybe you have been too strict on the family members and they can tell you that, yeah, please allow these people, please, if this and this can be done. So it helps to identify areas of excellence and areas that requires attention and improvement to delivery of care. The next is monitoring care plan effectiveness. So for you to evaluate yourself, you should also monitor the care plan if it is effective. Sometimes the plan of care we draw might not be very effective to bring outcome. So you should keep monitoring it regularly by reviewing and assessing the impact of interventions and treatments that you're giving. because we know in our interventions we have short-term and long-term interventions or goals. So you should be coming back to check part of your goal, which was a short-term, uh, is it positive? Is there any change? If not, then that is where you start from. It includes tracking the patient's response to treatment, evaluating management of symptoms, and measuring progress towards the established goal. I've just mentioned in most cases when we have a care plan, you should have a short-term goal and a long-term goal. So the short-term goal in most cases should be something that is achievable within at least 1 to 2 hours. Then the long-term goal is the one that can go for maybe weeks and depending on the condition. So monitoring care plan effectiveness allows timely adjustment, modification, and referrals if needed for optimal patient's outcome. The next is utilizing quality improvement measures. Utilizing quality improvement measure is essential in evaluating primary patient care. So it involves analyzing data, utilizing evidence-based guidelines, implementing best practice to enhance quality and safe care. So when you talk of utilizing quality improvement measures, we want to look at the quality of care that we have been giving. Sometimes you're going to provide care, even you yourself, you feel like, this one, really, I did not do something sensible. So you can go back and begin to evaluate the type of care that you gave. Was it really a quality and a safe one? We look at the safety and the quality because it impacts much on the patient's health. So quality improvement measures supports ongoing evaluation and implementations of strategies to improve patients' care delivery. So by looking at these quality improvements, it helps us to improve. If you know that whatever care that you gave to a particular person was actually not evidence, you are not utilizing the evidence-based guidelines, then you know that the care you gave was not a quality one and you should improve in the next care. Next is continuous professional development. We can do evaluation through continuous professional development. It plays a vital role also in the primary patient's care. It involves healthcare providers actively seeking opportunities to enhance their knowledge, skills, and competence. This is like continuous medical education. So at one point, if there was an error in whatever care that you had provided, you can always seek or enhance your knowledge. You can ask your colleagues to give you more ideas on or experience on whatever situation that you had handled wrongly, or even you can go and read more, you can attend trainings and all those things. So that helps you to develop professionally. Continuous professional development ensures healthcare providers stay up to date with current evidence, guidelines, best practice, contributing to ongoing improvements of primary care. So that was that on evaluating patients' needs assessment. So it is very important for all health workers to evaluate themselves or to evaluate themselves as a group after or even during the time when you are managing a patient, because it will help you to improve, it helps you to improve quality of care, it helps you to adjust, it helps you to make sure you stay up to date with current knowledge and guidelines. So thank you so much for attending this session with me. Till we meet again, Mrs. Prudence Amito.